As I mentioned earlier, there's so much taboo surrounding mental health in the Filipino community. But a good place to start is to understand the role of Filipino cultural values shape our understanding of mental health, as well as the dynamic of our relationships with our peers and family, including the way we communicate with each other. I've personally experienced both negative and positive aspects of Filipino cultural values on my mental health. It's important to note that these values are why Filipinos have such a strong sense of community, but at the same time allow us to understand the nuanced reasons why we have trouble navigating mental health issues and even communicating these to our peers. Kevin Nadal, a professor of psychology at the City University of New York and author of Filipino-American Psychology, cited four main cultural values that may affect Filipinos' mental health. I'll be going through each of these and how they may affect our ability to communicate our needs with our peers or friends and how we can move on from this. So the first one is utang na loob, which translates to debt of gratitude. So this refers to reciprocity and doing what's good for the collective. So how this affects communication is that it becomes easy to internalize feeling like you're a burden. Opening up to others with the expectation that you have to hold space for them too, which relates to kapwa, which means a sense of connectedness with one another. But oftentimes they may not have something to share, which leads to the cycle of self-censoring our emotions and repressing our emotions and not sharing our needs. This indebtedness is also a reason why many Filipinos fail to set boundaries. However, in failing to do so, we are only being dishonest to those around us. An example is when we are emotionally unable to hold space for our friends, but because of how much we value relationality, we allow them to anyway. This becomes not only draining for us, but gives them the false impression that we are able to hold space for them. The third cultural value is pakikisama. So the idea of social conformity, or the need to be accepted and for there to be peace and harmony among others. So if a situation benefits the collective but causes an individual pain or suffering, then that person might not choose to say anything because it might be received negatively by the entire group and cause disruption and conflict. So this is related to the value of social harmony. And this is why many Filipinos, including myself, might internalize a lot of their problems because they don't want to cause problems for their peers, their families, or their communities. Something I noticed within our community is how we often withhold our mental health concerns from our peers or our parents because being, quote unquote, crazy might make people in our community feel like our parents have done a bad job of raising us, using myself as an example. Right? A lot of my peers, including myself, keep our emotions to ourselves and show others and refuse to show others when we are struggling. Some also have our feelings dismissed growing up or, didn't have that space to talk about feelings. The final cultural value is hiya, or shame, which is governed by the notion that the goal of the individual is to represent oneself or one's family in the most honorable way, Nadal writes in Filipino-American Psychology. So there's a stigma attached to admitting that you are having mental health issues, and this can lead people to avoid seeking therapy for fear of bringing shame to the family, the community, and even themselves. For example, the shame comes from, a lot of different places, right? So some examples are, not graduating from college, or feeling shame that you didn't get married before you had a kid, or you haven't gotten married and you're 40 years old. So there are a lot of reasons why, mental health issues, there are a lot of mental health issues that can be attached to this feeling of shame. And talking about shame is hard and painful. But something good I've started to notice within our communities is that people are starting to open up. And I think understanding these cultural values and unpacking them collectively is one step towards encouraging each other to communicate our needs and express our feelings, which reduces some of the shame around mental health.